If you are currently in the market for a Medicare supplement plan, I would highly recommend you take a look at Mutual of Omaha. They currently rank number 2 in the nation as the second largest provider of Medicare supplement plans to beneficiaries. My name is Mark Prip. I've been helping people find the right Medicare plan for over 15 years, and today I wanted to show you some of the key features and benefits that Mutual of Omaha offers that we've come to love over the years when our clients are enrolled on one of their Medigap plans. So let's take a look. As I mentioned before, Mutual of Omaha ranks second with almost 10% market share and approximately 1.3 million members. Folks, they've been around a long time doing this. People love them. A couple features that I like about Mutual of Omaha is they have strong household discounts on their premiums if you qualify. They also offer optional dental and hearing plans for an additional premium, optional gym membership plans for additional premium. Let's take a look at the Plan G benefits. Now keep in mind, these benefits are not unique to Mutual of Omaha. These Plan G benefits are going to be the same no matter which company you enroll with. So right out of the gate, you can see with Medicare Part A, it's a $0 copay. Anything related to Medicare Part B, they'll pay 100% after you, as the member, have paid your $240 annual Part B deductible. Anything to do with outpatient testing and surgery is a $0 copay to you. Emergency room visits or doctor office visits, either one is going to be a $0 copay. Hospitalization and skilled nursing facility care, also a $0 copay. Foreign travel emergency care, lifetime maximum of up to $50,000 for foreign travel emergency care after a $250 deductible. Now, let's take a look at how much Mutual of Omaha Plan G actually costs. Here's an idea of what a 65-year-old non-smoker might pay for a Medicare Supplement Insurance Plan G compared to other popular Medigap plans. So at the top here, we can look at Plan G I ran for a 65-year-old male in the state of Texas, non-smokers, coming in at $139.66 per month. The cost of Plan G can vary based on age, location, and tobacco use. These are simply sample rates to give you an idea. Your rate can vary. Let's take a look at how Plan N compares to Plan G. Medigap Plan G offers coverage for Part B excess charges, while Medigap Plan N does not. Plan N requires you to pay copays for certain services, such as doctor and emergency room visits, while Plan G covers 100% of these areas. Let's talk about what Plan G does not cover. As I mentioned before, you're responsible for your Medicare Part B deductible. In 2024, that amount is $240. And Medigap Plan G, doesn't matter if it's Mutual of Omaha or any company, they do not cover prescription drugs. You will have to enroll in a separate Medicare Part D prescription drug plan. And last, I think, is a very important feature, no matter if it's Mutual of Omaha or Cigna or Aetna or United Healthcare, Plan G versus a Medicare Advantage plan, Plan G is going to be the superior option. Medigap Plan G does not require prior authorizations. Medicare Advantage plans do. A prior authorization means that, let's say you go into the emergency room, you're having complications of some kind, they want to run tests. If you have a Medicare Advantage plan, that facility or that provider may be delayed in treating you until the Medicare Advantage plan gives that prior authorization. So they send the request in, the insurance company has to authorize the test or procedure to be done. I always tell my clients, prior authorization equals delayed care. And in some cases, denied care where they deny the test or procedure. If you have a Medigap Plan G or any Medigap plan, they do not have prior authorizations. No Medigap plans have prior authorizations. That means no waiting or delayed care for you. Next on the list is Plan G has no network limits or referrals. Medicare Advantage plans require you to work within specific provider networks and possibly obtain referrals to see specialists. The benefits for Plan G remain the same year over year, while Medicare Advantage plan benefits change every year, or your plan can even be terminated if the insurance company exits your county. No provider disputes with Plan G. This has to be my second favorite feature of Plan G. Advantage plan companies often drop doctors and hospitals from their networks over payment disputes. Since Plan G does not use networks, disputes never take place. Just take a look at a lot of the headlines that pertain to Medicare, and a lot of them have to do with big provider disputes. A big hospital is in dispute with an insurance company because they can't settle on payment terms. So they end up terminating that contract, and everybody that was a member with that insurance company at that hospital will now be treated as out of network. That will never happen with a Medigap plan because Medigap plans do not use networks. So here's my final thoughts. We have hundreds and hundreds of clients on Mutual of Omaha. Medigap Plan N and Plan G are probably the two most popular ones. We love Mutual of Omaha with their additional ancillary benefits, their competitive rates, their long-term history in the Medicare space. They're not going anywhere. So if you'd like us to run a needs analysis for you, comment below, give us a call, and we'd be happy to help determine if Mutual of Omaha is a good fit for you. Thanks for watching.